The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar today will discuss financial and legal resources for brain tumor patients. My name is Joanne Demas. I'm the Senior Program Manager here at the American Brain Tumor Association. And I'm delighted to introduce our speaker today, my colleague, Crystal Ward. Crystal Ward is an oncology social worker and program manager at the American Brain Tumor Association. In her role here at the ABTA, she supports brain tumor support group facilitators across the country and develops brain tumor caregiver program. She also provides psychosocial support and resources to brain tumor patients and their caregivers through the ABTA's national toll-free care line. Crystal received her Master's of Social Work from Loyola University of Chicago. Thank you so much for joining us, Ms. Ward. You may now begin your presentation.
Thank you, Joanne. I'm so happy to be presenting today on an important topic, financial and legal resources for brain tumor patients. I specifically wrote the presentation today for patients and caregivers, but I did notice from our registration that we have several healthcare professionals on the webinar, and I'm really hopeful that this presentation will be helpful to you in your work as well. We have a lot to cover, so I'm going to jump right in. Do please feel comfortable submitting any questions as we go. So I do not have any conflict of interest related to this activity. And today's agenda, we have, like I said, a lot to cover. So we are going to go through just general financial concerns specific to brain tumor patients, health insurance tips, employment disability policy resources, prescription assistance resources, and special considerations specific to benign and metastatic brain tumor patients, how family and friends can help, and how you can find resources on the ABTA website. And I also have a listing of some of the resources at the end of this presentation. I'm happy to provide the presentation PowerPoint to those on the call today as well. So financial concerns for brain tumor patients. Brain tumors are rare, and because fewer people are in need of these drugs, they have very high costs and limited generic options. According to a study by Yabroff in 2008, brain tumor patients face the highest treatment costs compared to all other cancer diagnoses. Brain tumor patients and families also face unique hidden costs to their care. Not only are their treatments specialized, but there are fewer institutions with expertise in treating brain tumors, making it a necessity for some patients to travel far distances for standard care. Transportation and housing for treatment, second opinions, and follow-up appointments all become a concern. According to a study by Tumor et al., recently published by the Journal of Neuro-Oncology Practice and funded by the ABTA, the monthly out-of-pocket expenses for patients diagnosed with a primary glioblastoma or GBM diagnosis was about $2,500. Medication copays, transportation, and hospital bills were all three of the highest costs for patients. As a patient's tumor progresses and the symptoms of cognitive and personality changes, loss of memory, loss of mobility, and other functions become more profound, families often face more significant financial concerns. The Tumor et al. Study also suggested that the monthly out-of-pocket costs are higher for brain tumor patients than other cancer diagnoses due to these impaired neurological functions. We also know that these neurological changes increase the patient's need for additional care in the home. This is even the case if the patient is enrolled in hospice. If the patient's insurance doesn't cover home aid or home care, the family is left paying out of pocket between $18 and $22 an hour for personal aid, or the spouse and other family members are forced to take time off of work to provide care and supervision. Either way, this is often very difficult on the family. So talking about money can be difficult, and many of the patients who call us at the ABTA tell us they really fear bringing these concerns to their healthcare team because they don't want it to impact the quality of their care. They tell us if I tell them, they will recommend a cheap, less effective treatment, or they won't treat me at all. The truth is, many patients end up with excessive medical debt and overwhelming financial stress on their family rather than discussing this with their healthcare team. Medical providers have a very important role to play here. By simply acknowledging this issue when the patient comes for their first few appointments, you can open up the door to finding resources for them and alleviate a lot of additional stress on their family as they're already going through this brain tumor journey. I encourage patients to be your own advocate. Bringing these concerns to your team early can alleviate a lot of the stress for you later on in the diagnosis and care. Obviously, ensuring you have insurance is a primary concern when facing a financial impact of a brain tumor diagnosis. The average out-of-pocket cost for a craniotomy can be anywhere from $50,000 to $150,000 depending on the institution. And going back to the Kumtaker et al. Study, it can cost a family almost $30,000 a year for GBM treatment. If you don't have insurance, your primary goal will be to apply for Medicaid, Medicare, an exchange policy, or private insurance to alleviate these costs. And if you do have insurance, there are some helpful tips that can help you maximize your benefits. Most insurance companies are now offering case managers for patients so that you have one contact for your insurance concerns, approvals, and referrals. If you create a relationship with the case manager at your insurance provider, they may be able to help expedite approvals and explain billing details more effectively for you. Not all companies are forthcoming that they have this option or that you need this option, so you may have to request it specifically when you're contacting your insurance provider. Be sure to keep accurate records of all communications related to your bills, including the date, time, and who you spoke to. Again, it just goes back to establishing a relationship with your insurance provider and having a contact who is familiar with your circumstance. This can also alleviate a lot of stress that comes from just explaining your story to multiple people numerous times. Pre-authorizations are also important to be aware of, and where you're being treated. Your clinic's social worker or nurse practitioners are often very helpful in helping with pre-authorizations should you need them. Two very important ways you can also save money and alleviate some of these burdens of the cost of care is to be sure to check your bills for any mistakes and compare your bills with your explanation of benefits or EOBs to ensure all medical costs were submitted to your insurance company first. Sometimes when you have a procedure, you get a bill in the mail before you even get home versus them submitting it to your insurance company. So do be sure to check that. Many patients have saved thousands just by ensuring they were billed for the right services and nothing more. So check for mistakes as well. And health insurance appeals. Unfortunately, just given the cognitive issues that sometimes come with a brain tumor diagnosis, patients don't always understand what it is that their insurance company is denying and why. This is especially the case for patients who have limited social support. So it's important to bring a physical copy of your denial to your social worker or financial counselor where you're being treated, because they can be helpful kind of navigating through this and clarifying what is being denied and why. Be sure to keep deadlines in mind throughout that entire process. Another resource is your employer or HR representative. Informing them of any issues you're having just provides you another advocate, and they can contact the insurance provider and let them know one of their members are having difficulties with their coverage. The National Cancer Legal Services Network, or NCLSN, offers a service directory that can connect you to legal services locally by state and pro bono attorneys that can help you with these appeals. Additionally, each state has a Department of Commissioner of Insurance and local consumer protection agency that can also help you with complicated appeals. So COBRA, many people have called us and have questions about COBRA. Here are some just brief facts to keep in mind when electing COBRA as your insurance coverage. The most important things to remember is that you only have 60 days to elect COBRA coverage after you leave your job, and the premiums must be paid on time or you do risk losing this coverage. COBRA can end if your employer decides not to offer group health care coverage or if you become eligible for Medicare. The Employee Benefits Security Administration actually has benefit advisors that can help answer any questions about your COBRA benefits, and they can also let you know if you qualify for any premium assistance for those high premiums. And that website is at the bottom of this slide, and the 800 number as well. Affordable Care Act. Although there have been many significant issues with the rollout of ACA, it does provide many protections for brain tumor patients and helps alleviate financial barriers in several ways. Patients cannot be denied coverage because they have a brain tumor or other pre-existing condition. Medicaid was expanded in many states to adults under 133% of the federal poverty level. And health insurance exchange policies are available for those who aren't eligible for Medicaid or Medicare and don't have employer-based insurance. Open enrollment began on November 15th and ends February 15th. And should you lose your health insurance for any reason in 2015, this does qualify you for a special enrollment period in the exchanges. And you will have 60 days after losing that coverage to elect an exchange plan. Healthcare.gov is the website I would recommend going if that's getting on one of the exchange policies is important. Also, the Premium Assistance Tax Credit took effect this year and provides a tax credit for households that earn about $46,000 individually or $94,000 for a family of 4 in 2014. This is going to be adjusted every year for inflation. The Medicare donut hole was closed over time. And what a lot of people don't know is that the ACA does also attempt to make healthcare costs more transparent to the public. The hope is to inform patients before procedures of the costs and reveal cost discrepancies among institutions. According to the law, hospitals must provide patients with the estimated cost of their procedure before they are performed if the patient requests the information. Unfortunately, a lot of hospitals aren't abiding by this new policy or aren't aware of it. And the current data available through the Centers for Medicare and Medicaid Services is very complex for most to navigate, especially those in underserved populations. So the Federal Centers for Medicare and Medicaid Services did reveal a database of all of these claims for over 160,000 individual charges at over 3,000 hospitals located in 300 metropolitan areas. You can navigate the database and search for specific procedures and institutions. This may be especially helpful for any uninsured patients. Again, it is a very complex database, so asking a social worker, financial counselor, or computer-savvy friend or family member to help may be useful. The database can be found by searching the Medicare provider utilization and payment data. It is still important to check with the hospital or medical provider to confirm the cost before making decisions based on this information on the website. So making the decision not to work, employment is another huge financial stressor for brain tumor patients. And as many of you know, how a patient copes and their ability to work throughout the brain tumor journey can vary greatly depending on the type of tumor they have, their treatment, their social support, and their personal response to the diagnosis. We've had meningioma patients, unable to cope with the symptoms to the point of receiving Social Security disability, and others with GBM or glioblastomas working almost all the way up until months before needing hospice. So it really depends on each patient's circumstance. Cancer and Careers offers a helpful list of questions to help you kind of evaluate your decision to work or not. It's also important to keep in mind the employment situation of the caregiver and how the needs of the patient may impact their employment situation. Coming soon, the ABTA will be releasing more resources for patients navigating the issues of going back to work, including reasonable accommodations in the workplace. So keep an eye out for those as well on our website. Family Medical Leave Act, although FMLA is typically unpaid time, it's still important for protecting that insurance coverage for either you or your partner or family. So again, it just goes back to having coverage and not paying out of pocket for all of those expenses. Short-term and long-term disability plans can also provide you with some financial income during times of treatment and recovery. Every employer is really different as to what type of plan they offer employees, so it's really important to know your policy and to contact your HR representative for the details of what it includes. Here's some just general facts about this type of coverage. Basically, short-term disability can be typically anywhere from at least 3 weeks of income at 40% or more of your earnings, and once short-term is exhausted, long-term disability is activated anywhere from 50 to 70% of your earnings after the time, and it can be a specific amount of time to receive those. Your employer does dictate the eligibility for this, so they may require that you have worked full-time for a minimum of 1 year with the company, for example. Social Security disability is an important source of income for many patients, especially if your physician anticipates you won't be able to return to work for an extended period of time. Typically it is for a year or longer. Here's some important things to note about SSDI. You must have worked 5 out of the past 10 years. If you did not work 5 out of the past 10 years, you can apply for SSI or supplemental security income instead for low income patients. Also, if you have any minor children in your family, they can also receive disability benefits when you're on Social Security. And you are eligible for Medicare Part A and B after 2 years. However, it is important to note that enrollment is not automatic for Medicare prescription coverage or Part D, and you still do need to apply for that type of coverage. We have a lot of questions about that and assuming you're automatically applied, but you're not. Any short-term or long-term disability coverage that you have from your employer should not affect your Social Security benefits, but there are some other disability payments that may, depending on what's available with your employer. So it's still important to talk to your HR representative and the Social Security Department if you're on any of those disability policies to see how they interact with each other. There is a 6-month waiting period before you receive the first payment. This is retroactively paid, however, it can be pretty difficult for patients who have no other source of income during that waiting time. So to kind of expedite that waiting time, you may have expedited approval if your diagnosis falls into what's called the compassionate allowance category. This is just a quick way for the administration to identify diseases that qualify patients for SSDI with minimal objective medical information. Overall, it can expedite a patient's application, but this expedition still might take up to 3 months. Here are the current brain tumor diagnoses included on the compassionate allowance category. Oligo grade 3 is actually new and just recently added in the past few months, so definitely check that website if your diagnosis isn't listed here and see if it is in the weeks and months to come. Prescription assistance. Depending on your situation, prescription costs can add additional financial stress, especially if you have any of these listed situations. There are several resources that can assist you with these prescription costs. Discount programs, Walmart, Target, and Walgreens all offer 90-day prescriptions for just $10, and they have a $4 generic offered through their discount programs as well, and there's multiple strengths of various steroids, anti-epileptic drugs, and several antidepressants listed in that discount program. A great website is goodrx.com. This is great for searching prescriptions at your local pharmacy to see which pharmacy has the cheapest costs. A lot of the pharmacies negotiate what the cost is for the prescription, so this is especially helpful for patients in the donut hole or without prescription insurance. It also includes any coupon discounts for the drugs that you're looking for, and you can automatically print them from that website. Prescription assistance programs help with the co-pays and the cost of the drug if you have no insurance or prescription coverage. And Needy Meds is a website that's a great tool to search for these programs specific to either generic or the brand name of the drug. You can easily see the eligibility of the programs and print the applications or go to their online web applications. This is most helpful for steroids, pain medications, and antidepressants. Copay assistance, unfortunately this is pretty limited, especially for benign brain tumor patients. Right now the only two programs assisting brain tumor patients is Nucella through their brain tumor drug copayment assistance program and Cancer Care. Cancer Care will only cover GBM patients, and Nucella will only cover primary malignant brain tumors such as GBM, oligos, and anaplastic astrocytomas. Both programs open and close based on the amount of funding they have, and Nucella just reopened about a month ago, so important to check as well. Temodar assistance. Temodar is one of the most costly chemo drugs for brain tumor patients. Hundreds of brain tumor patients were recently receiving assistance through the ACT Patient Assistance Program through Merck. And that program has since closed. Merck is in the process of reevaluating opening the program again, but just due to the overwhelming concern that they received from patients and caregivers and social workers and nurses, Merck did open their general patient assistance program to brain tumor patients, and we're grateful for that. They are only accepting mailed applications at this time, so here are the details for applying. If you do not meet the eligibility requirements on their website, I would still recommend applying and adding a personalized letter about your circumstance with your application. They actually state on their website, at Merck, we realize that sometimes exceptions need to be made based on the patient's individual circumstances. If you do not meet prescription drug coverage criteria, your income meets the program criteria, and there are special circumstances, either financial or medical hardships, that apply to your situation, you can request an exception be made for you. So even if you don't meet what's on their site, I still recommend applying if this is a drug that you're struggling to pay for, copay or just full coverage of the drug. We talked about special circumstances, and benign brain tumor patients face particular challenges obtaining financial assistance. It can be a long-term chronic condition, and although they face many of the same treatments, symptoms, and side effects as cancerous brain tumor patients, they often have very difficult times maintaining employment, and there's very little assistance available to them. Here are just a few considerations if you're in this category. If you're having difficulty working, you may want to apply for Social Security disability. You may be approved. You may not be approved when you apply just solely on your benign tumor diagnosis. However, if you have any secondary diagnoses, such as a physical disability from the tumor or limitations from any mental health conditions, those may actually get you Social Security disability before your benign tumor diagnosis would. You may also be able to get assistance through the HealthWell Foundation if you have any of the secondary diagnoses that they cover. Their coverage or assistance changes based on the funding that they have as well. And they have a listing available on their website of the diagnoses that they cover, so be sure to check that. And metastatic brain tumors, because resources are very limited for brain tumor patients in general, researching available assistance based on your primary cancer diagnosis, such as lung cancer or breast cancer, may actually open additional opportunities for financial support to you, including Cancer Care's copayment assistance program. They actually cover breast cancer and some other cancer diagnoses that you might qualify for. Again, you might also qualify for Social Security disability or the HealthWell Foundation with your primary cancer diagnosis versus the brain tumor diagnosis. Getting help from family and friends. Have you ever been asked by family, friends, and coworkers, let me know if there's anything I can do to help? Patients and their families often get these general offers to help, especially immediately upon learning of the patient's diagnosis. There are some simple practical ways that these well-intentioned loved ones can help alleviate some of your financial stress. It may be difficult to ask for help, but I really encourage you to make a list of at least 3 things you would be willing to accept and sharing these with those loved ones who offer. Anything from meals, driving patient to their treatment, watching their pets so that they don't have to board them during surgeries or hospital stays, picking up their prescriptions and paying for them, and gift cards to nearby stores are extremely helpful. And as patients, if you are experiencing a high amount of medical debt or are in that benign brain tumor category with limited assistance available, personal fundraising pages can be especially helpful. Here are just a few websites that other patients have found useful. A good tip when creating your page is to really identify your most costly expense and write your page or story specific to why you need support for that cost. For example, if you have a $600 monthly prescription copay for certain symptoms, or you need in-home nursing care at $3,000 a month, this can be a great option to request assistance for those costs. It's also might be an opportunity for a family member or friend to set up your page for you, and one of the tasks that you can kind of charge them with assisting you. So obviously everyone's experience is different, but we do know that brain tumor patients have far more expenses than other cancer patients, putting them at high risk for medical debt. A financial counselor can offer you some guidance and peace of mind that you're making the best decisions for you and your family. I would suggest reaching out to your family and friends, coworkers, or even other support group members for recommended advisors in your area. Be sure to discuss any fees that they may have, their experience with working with cancer or brain tumor patients, and how familiar they are with medical coverage and medical expenses. If you have life insurance, it may be possible to receive income through loans, accelerated death benefit, or viatical settlements. And credit counseling is important if you're worried about the amount of debt you're incurring. And the National Foundation of Credit Counseling has some really great resources and counseling for that as well. So I've included a general listing of resources within this presentation, but you can see our full listing of financial, travel, and housing resources at our website. And I'll kind of go through on our site where to find those in the next few slides. We also have numerous publications available on various types of tumors and their treatments. These are great for newly diagnosed patients, but can also be shared with your employers, friends, and family to help them better understand what you're going through. And as always, our care line is available to both you and your loved ones and healthcare professionals. We'd love to take your calls and answer questions as well. Julianne and I, as well as our nurse, Mary Lovely, can answer any questions, provide emotional support, and help you connect to resources specific to your situation. So here is where you can find the resources on our website. You can go, it's under the Treatment and Care tab at the very top of the site, and then you're going to click down on the drop-down menu on Support and Resources. Once you come to the Support and Resources page, you're then going to go to the Financial and Medical Assistance and Travel and Housing Assistance tabs for a complete listing of all of the resources that we're aware of for brain tumor patients, both benign, cancerous, and metastatic tumors. And the eligibility requirements for a lot of the programs, a summary of them is already listed there. So age requirements, diagnoses specific is all listed, which can be very helpful so you don't have to go to each program individually to check eligibility. And as I mentioned, I just have some legal resources here for those health insurance appeal processes. If you're having any employer concerns, these are all great resources. And employment resources for both caregivers and patients, the FMLA, the U.S. Department of Labor, ADA, where you can find what reasonable accommodations information there, And Cancer and Careers is a wonderful wealth of resources for patients. They can actually review your resume, talk to you about if you have any gaps in your resume of when you were working, how to explain that, and also how to work through reasonable accommodations in the workplace. And here are some just general financial assistance programs I wanted to pull off of our website to be made known for patients and families. Cancer Care, if women and children with all diagnoses, they do transportation, home care, and child care assistance. And Mission for Marine can do medical bills, child care, housing, utilities, and transportation. This is only for malignant brain tumors. And the Cancer Financial Assistance Coalition actually has a resource directory by diagnosis and what type of assistance you need, and you can get all the resources on that website. Again, this is just a good information to keep in mind if you're struggling with any of these costs. So thank you so much. I know it was high level, and I'm looking forward to hearing all the questions.
Wonderful. Thank you, Crystal, so much for your presentation. I'm sure everyone learned a lot, and we do have some questions that were submitted during the webinar, as well as some questions that were submitted when people registered. So we have some time, and I know you're willing to answer some of these questions. So we'll start and see how many we can get through. First question is, what do you suggest when someone is billed for a service that was not performed?
So it's definitely important to contact the hospital to make sure, or the medical provider of wherever that service was done, and seeing if you can resolve it on their end. If they are adamant that they did provide that service and you're saying they didn't, it's important to talk to your insurance company, because your insurance company is not going to pay for something that you are adamant that you weren't provided, if that makes sense. So I would talk to the medical provider first and then your insurance company to see if it's resolved, and if it continues to be a problem, going back to those legal resources.
Good idea.
Yeah.
And it's good to know there's legal resources out there, that there's people on your side. You feel alone so many times. So.
And this is very common for patients because it's such a complex system, and it can get very sticky. That's where these resources can come into play, because you're working with multiple systems to resolve these issues. So.
Perfect. Speaking of legal issues, someone's asking, what legal rights do I have from a work standpoint? They're asking that they work more hours than they're able to in a work week. So they're unable to do that due to their treatment and their medical issues due to the brain tumor. So what about those legal issues?
Yeah, this is huge for our patients, because many of them, your work is your sense of identity for many people, and it's a huge loss if you can't maintain that employment, and if your employer is not sensitive to your situation. And thankfully there are laws that protect patients in this situation. So it's through the American Disability Act. It would be under reasonable accommodations, and I actually have anticipated a question like that, so I'm glad I brought it. But just for patients to know, reasonable accommodations defined by the American with Disabilities Act is any change in the environment or in the way things are customarily done that enables an individual with a disability to enjoy equal employment opportunity. So making these reasonable accommodations, they have to, based on your diagnosis. And that does mean that you have to work with your HR department, and there may be some disclosure that you have to share with them as far as what you're going through medically. But patients have found with reasonable accommodations, talking to them, working out a schedule that fits to the best time of day that works for them. So let's say they have chemo 1 week and the mornings are really rough for them. So starting at 11 o'clock and working a full, a schedule later into the day, that would be considered a reasonable accommodation. Okay. If the job, says that it's really going to hinder their productivity and have something back on their work and they're going to fight that, there are ways to change a position within an organization too, and that can fall into reasonable accommodations as well. So it might not be the exact position you were in before your diagnosis, but figuring out a new position and other responsibilities that you can take might fall into that. A great resource for these questions is Cancer and Careers that I had on the employment slide. And like I mentioned, we're actually coming out with some materials specific to brain tumor patients, hopefully in late or early summer, I should say. So keep an eye out for those. Yeah, so I hope that answers that question.
That sounds great and exciting stuff to know that ABTA is coming out with new stuff all the time. So, make sure that you've signed up with ABTA and provided us with your email address so you are one of the first to know when those resources are available. I'm going to make this next one a two-part question. It's about resources for a child with a benign brain tumor, but let's talk about, are there resources for a benign child, but does ABTA have resources listed for children, financial resources as well too?
Yep, absolutely. I'm actually going to go back to our page here. Bear with me. So right here on our page, if I can get the mouse, here we go. If you click right here on Programs for Children, it just goes right through all of the different assistance programs that we know of and the diagnoses that they would fall under. So it's still important to kind of look through those to see which ones the child might qualify for, but we do have the resources listed there. And some of the general financial assistance programs may cover children. So even though it's under the general and not specific in the children's section, check those as well.
That's good to know too.
Yeah. The other piece of that, I think you said, is just young adults. I know we're talking children, but
they fall into that.
Yeah. So there are, throughout their website, we do have the age requirements too. If a certain program, is only covering 18 to 40-year-olds, that's listed, and we know that there are actually more assistance programs for the young adult population than there would be for the adult, the over 40 population. So just making sure you're going through that list and thinking of your situation.
It's really important too. Yeah, and we try to keep that listing as updated as possible, and we add new resources. We just added a new resource today under transportation, so we encourage you to check back at our website often because we know you're always looking for more financial assistance. So,
and certainly, we know we have healthcare professionals on the line, so if you're aware of programs either in your state or locally, that's one thing that we try to include on our site as well, but we're not as familiar if it is not brought to our attention. So if you have any local resources you'd like to share with us to get added, definitely send myself or Jillian an email or call the care line. It'd be helpful.
Definitely. Thank you. Someone's wondering about out-of-network providers. So could you explain first what it means when you go out-of-network, what the financial implications of it? And this specific person is asking, how do I make sure that my provider is not making me go out-of-network without my knowledge?
Yeah. And this really comes back to, as social workers, nurses, medical providers, we're really looking at the patient, wanting them to get the, best treatment possible regardless of cost. So sometimes thinking about those finances and how that impacts the patient isn't forefront for the healthcare providers. And, they may recommend a prescription drug or a specialist and not knowing that they're out of network for you. So this comes back to the patient, advocating for yourself and knowing your policy and just doing your due diligence of making sure that whatever treatment you're going for is covered by your insurance. And that would be going back to seeing if you have that case manager at your healthcare provider and, giving them a call and letting them know their circumstances and seeing maybe that specialist isn't in your network, but someone at the same caliber expertise is covered by your plan, and they can share with you who that might be. So building that relationship with the insurance provider through that case manager is important and can help in situations like this tremendously.
That is. And that relationship is key. Mm-hmm. Once you start that, they will be more familiar with you and want to help you even more. So definitely.
Yeah. And even if you don't have an exact case manager, let's say you call your insurance provider and they say we don't offer that service, which may happen, but getting the name of one specific person, saying is there just, what's your name, and asking for them specifically when you call, they, might not have the title of your case manager, but they're kind of serving in that role then.
Right. Keeping good records.
Yes.
Who you talk to, when you talk to them, definitely. So
exactly.
Here's a good question. Can you address getting a second opinion at a different facility that doesn't accept your primary insurance, and even expand upon it perhaps about, we hear questions about Medicaid, mm-hmm. And going to a different state, if you have Medicaid in one state and needing treatment at another state.
Yeah, so this is really challenging for patients, and we have a lot of patients and caregivers call us very frustrated with this process, unfortunately. So first of all, addressing the second opinion. So again, it's just knowing your insurance, and if it isn't covered by your insurance, unfortunately that cost does go back onto you to pay out of pocket the full amount, which, if you're struggling with the cost is very disconcerting. But that is the reality of that situation. If you have Medicaid and you're trying to get services in another state and they're denying it, it's actually, you can appeal that. So, if, let's say, you're getting service at a place a couple hours away because they take Medicaid, but you're right near a state border, a state line, and another hospital is within an hour or less of you, but it's just another state over. You can appeal that decision, let them know your specific situation, and that, their specialists. The other piece of this is a brain tumor treatment, you typically do need specialists. So letting them know that, hey, this specialist is only an hour away and I have transportation concerns, I have financial concerns, putting that appeal into place. It may take some time, so you might not be able to get your second opinion or your treatment done quickly, but it, taking some effort and doing that work ahead of time may be able to get you the Medicaid in the other state. I would recommend, I worked with a couple of patients who found it helpful to call the social worker or financial counselor at the institution where they're trying to get treated at. So if it's across that state line and they really want to go to that facility, going to that brain tumor clinic, finding out who their social worker or financial counselor is, and seeing if they can help with that appeal process and kind of give some more oomph to your appeal.
Nice. So good suggestion. Okay. A good question about, we talked about children, we talked about young adults. What about that child that is nearing adulthood? What about, their benefits, on insurance plans with their parents and nearing adulthood, that phase where they're not a child yet. How do you help them?
So thankfully, because of the Affordable Care Act, young adults can stay on their parents' coverage until they're 26. But for those who are we do have some calls where patients are, 27 or going to be turning 27 and losing their parents' coverage, and they did not work those 5 years. They did not work those 5 years to qualify for Social Security disability and receive those benefits and therefore qualify for Medicare and other services. That's appropriate for them to then apply for Medicaid, and applying for Medicaid then will provide them insurance coverage. So it is a little trickier depending on what their parents' plan is, their age, if they do have any type of employment, if they can elect COBRA, like we talked about as well, that might be an option for them. Yeah, it is a good question though.
Sure. What about clinical trials? We hear this question a lot, and are clinical trials free, or do you have to pay for them? Are they covered by insurance?
Yeah, so clinical trials, it definitely depends on your insurance plan and what clinical trials you're on and what drugs are being recommended. But clinical trials does not mean you have to pay out of pocket for all of those. Oftentimes insurance, if you have insurance, will pick up much of the treatment costs because it falls into everyone on a clinical trial at least gets standard of care for their brain tumor. So that standard of care is going to be covered by whatever their coverage is with their insurance, if that makes sense.
Definitely.
Yeah, and we do have, there's a few organizations that we have listed on the website that do provide financial assistance specific to patients who are on clinical trials. So if you're in a clinical trial a few hours away and you need some gas money or transportation, housing costs associated with getting your treatment, that might fall into being eligible for these assistance programs also.
Again, perfect lead into my next question. Several of these questions are about just, we have insurance or we have Social Security disability, we're not poor, but we're still not meeting the day-to-day expenses. We just can't get ahead of the medical bills. What do we do? How can you help them, Crystal?
Yeah, it's, gosh, we get a lot of just patients and families. This can be very emotional also. You're going through treatment and the journey, and then you're also having to deal with the issues of insurance and paying for all of this. And it doesn't matter. Even if you go on to some of these assistance programs, they're not going to cover you for the entire time. They may only cover a certain portion of the drug, or they may only cover you for 3 or 4 months, or whatever program that is. So at some point, all patients kind of fall into this, coping with the cost of the care. And it does take some problem solving and going back and really going through your expenses and negotiating what you can, what are the musts for you, what are, that you need for your daily life, and then also, what are some ways that you can change your lifestyle to maybe not have the most expensive car, or, not move into a more reasonable housing situation. There are some utility programs that can help if you're struggling with your utility bills. And I know we've also talked about if you're possibly struggling with your car payment, but you're paying a high cost for a copay, maybe getting on a copay assistance program to help with that high copay and using those funds for then your car payment. So it does take really budgeting, figuring out your situation, and then evaluating your expenses and what you can do that way. There's no quick fix, unfortunately, for families.
Right.
I wish there was. As a social worker, I would be sharing that with everyone.
Right, the magic bullet.
Yeah.
And you did mention that, while this is a practical, concrete issue, it is an emotional issue. So what would you say to our listeners? How else can we help them?
Sure. There's always the care line. I love pitching,
Yes.
the care line. We're happy to take any of your calls and questions and kind of work through what resources might be able to assist you. But also, really reaching out and talking to other patients and can be a huge support because, some of those patients who aren't newly diagnosed have been through it for a few years now. They have some really great tricks and tips that they've come across, and support groups are fantastic. We have a listing of local support groups on our website, and we also have Connections, which Jillian, your program manager over our Connections, it's an online support community for patients, and you can share your situation on there, and other patients and families can kind of chime in and let you know how they've navigated through that issue. It's also going back to talking to your medical team and letting them know, like, listen, I'm trying to go through treatment and I'm doing the best I can, but every day I'm spending hours talking to my insurance provider, and that's very stressful for me when I'm trying to recover from chemo or radiation and fatigued, and that goes into your quality of life. So letting your medical team know, like, this is stressful and something that you're dealing with, they might be able to help alleviate and find solutions for you also.
Perfect. There is another question. We probably have time for one or two more. Someone is asking about what type of insurance do you suggest when going out of the country?
That's a rare question, but
Yeah.
a good one. We actually, it definitely depends on the country because, as you know, healthcare systems vary very greatly. And most, when patients come to us from out of the country, they have to pay the full cost of care typically. So I imagine it's going to be very similar if you're going out of country. Mm-hmm. I do know that our colleagues at the International Brain Tumor Alliance are fantastic for kind of navigating what resources are available in each country. So I would just kind of give them as a resource, mm-hmm. and happy to provide that information.
Sure.
If anyone is needing it.
Definitely. And their web address is?
Yeah, it's www.theibta.org. Mm-hmm. O-R-G.
Perfect. Yes. I think this is a good one to clarify. Someone is asking a good direct question, and we do hear this a lot. Does ABTA offer direct financial assistance? They're asking for caregivers, but it could be for patients. So does ABTA offer the financial assistance?
Yeah, quick and easy answer is no. But it is something that is always brought to our attention. But it's, the resources that we have here, it's not something that we can sustain, and it's really important because there are other financial assistance programs based on various eligibility criteria. We just try to be the clearinghouse here to connect patients and families to other resources. Mm-hmm. Our funding and the donations that come to us really provide for our care line, our programs and educational materials, and a lot of our research funding. So we try to use our donations wisely, and it's just, unfortunately, it would just really wipe out any of our funding if we opened up a financial assistance program, because we are national and there are so many people in need at a very high level for this care. So yeah, if we have a lot of patients win the lottery and send everything over, but I wish there was a quick fix for that.
And do you have time for one more question?
Sure.
Okay, I'll ask this one then. So if you're in a clinical trial, we mentioned that, and we talked about what can be covered or not. The drug is covered by the clinical trial company, mm-hmm. But what if you have a side effect from that? Mm-hmm. Does your insurance company cover that, or does the clinical trial company cover that?
Oh gosh. Yeah, that's a tough one. So it really is very unlikely if it's transportation issues or, how is it affecting you?
Right.
And that would not be covered by your insurance provider. And I mean, I'm looking at the question, paying for eye medications, things like that would. If it's a medication or a treatment for the side effect, yes, that may be covered in your insurance plan. But let's say it impacts you to the point where you can't drive and you're needing to take a taxi or having family members, they're not going to pick up those transportation costs. But there are resources to kind of navigate those issues. So travel, transportation, paratransit transportation in each state, depending on your state, can be very useful in those situations. So, yeah, tough question.
Yeah, and I think it would depend, too, on your insurance company. So those real personal questions, you know, we always encourage you to, ask your insurance company. So definitely. Sliding one more in, do the resources available through ABTA offer gas cards? Can you just reiterate?
No, we don't provide any direct financial assistance to patients and families, but there are several organizations listed on our website under the travel and housing assistance right here. There are a few on there that do offer gas cards, and Jillian mentioned we just uploaded a new resource we found out about on there today. So we try to keep it up to date so you don't have to go to other areas to find those services. But no, we do not provide direct assistance.
Okay. I think that's all the time we have for questions today. I want to just mention one thing, because it's a question I've been answering just privately to a lot of you online. Yes, Crystal's PowerPoint will be available to anyone who wants it. We will post it at the website along with the transcript and along with the actual video. So you will be able to have it 3 different ways. So if you wait patiently for us to get up to the website, it usually takes a day or 2. You will have it available in 3 different formats to share with your family and friends.
And it'll be emailed to everyone. Also, the link of where to find it on the website.
The link is emailed to everyone, and then you can share that link to other people too. So we appreciate that. To anyone that you think this would be helpful to, share the link, because we do think that these webinars are helpful. So that's all the time. So Crystal, thank you so much. We really appreciate it. We also have more information, as you mentioned, on brain tumors and treatment options. Our licensed healthcare professionals, Crystal and myself, as well as Mary, our nurse, can provide support, help you navigate our website, as Crystal showed you some of it. There's very, very, very much more on our website. So you can call us on our care line, which is 800-886-2282. Again, that's 800-886-2282. Or you can email us at abtacares@abta.org. So we're going to pause for just a moment, and then I will come back with some information about our next webinars that you will not want to miss.